Hello, in this video, I'll be talking about oligometastatic disease. What is it? What does it mean? How is it treated? And what is the prognosis? Before I go on, I'd love to invite you to subscribe to our channel. We put content out about 3 times a week, so there's always something new to watch. So what is oligometastatic disease? The word oligo comes from the Greek few. So when we talk about oligometastatic disease, we're talking about people who have advanced breast cancer and the disease has spread to other parts of the body, but there's involvement with 5 or fewer sites that we can see. Now, as you know, if you've been watching these videos, there are cells that we can't see throughout the body. So we're talking in particular about disease we can measure or see on a bone scan. We're talking about people who, usually these are people just diagnosed, where we find only a couple of spots or lesions, we often refer to them. They might be in the liver, the lung, or the bone, for example. And if there are 5 or fewer, this is called oligometastatic disease. Why does it matter? Well, oligometastatic disease is often treated in the current era with very focused doses of, in particular, radiation therapy. So if we see 5 or fewer spots of disease, if you are in a radiation center that can treat you in this way, we will give high doses of radiation therapy to that area and a rim of normal tissue surrounding that area in an attempt to sterilize, if you will, that area of cancer. In general, people who present with this type of metastatic disease have hormone receptor positive disease. It can be HER2 negative or HER2 positive. Check out our videos if you want to learn more about ER status, estrogen status, receptor status, progesterone receptor status, and the HER2 status. And we generally see that these patients are treated with targeted therapy and endocrine therapy. Would it be possible in somebody whose tumor is ER negative, PR negative, and HER2 negative, also called triple negative, to have oligometastatic disease? Absolutely, though it's less common. So when people with triple negative disease have advanced disease, it tends to be in more areas than 5. So we give sterilizing radiation therapy, as I mentioned. You might be wondering, what about surgery? Occasionally surgery is done. The primary times that experts will see people having surgery are when that area is removed because we don't know what it is. So if there's a lesion in the lung and the only way to figure out what it is to remove it, that would be surgery for this type of cancer. But in breast cancer in general, we don't surgically go after areas that we see. It's not been shown to improve survival in the vast majority of cases. There are always exceptions, of course, and radiation therapy to those areas causes fewer complications and is more effective in sterilizing that area. Now, what do we know about this type of radiation therapy for this type of metastatic cancer? Most studies have followed people for 1 to 2 years, and it looks as though we get very good disease control. So we don't tend to see what are called in-field failures. So we don't tend to see cancer growing in the area that was radiated. It doesn't grow again in that area because such high doses were given. And because it's very carefully shaped to the area of the cancer, we don't see a lot of side effects or normal tissues getting radiated. We do know, of course, because we're not radiating the entire body, that other areas can grow, other areas that weren't radiated. And that's why we try to keep people on systemic therapy like endocrine therapy and targeted therapy for a good long time till we know that that disease is under control and new areas aren't growing. You know, I've seen patients and heard of patients who have had this type of radiation therapy and been on endocrine therapy for decades before another area shows up in their body. You know, we can't say this will be the case for everybody, but this is a unique situation in which local disease control, controlling disease where we see it, in addition to systemic disease, the whole body, can improve people's outcome. So it doesn't apply to a lot of people. This is probably 1 to 10% of people, but if you're one of those, it's a nice option to know about. I hope this has been helpful. Drop a comment or question below. You didn't think you would be learning about Greek, did you, when you watched this video today? And of course, subscribe to our channel, and you can also follow us on Instagram. Thank you so much for watching.